there. My name is Dr. Cozy. It's really nice to meet you. I am the physician that's going to be directing your sleep study as well as observing you throughout the night. Before we get started, do you have any questions or concerns for me? Okay, that is a really common one. What happens if I'm unable to fall asleep? Even if you can't fall asleep, that's still really good information for us. I will be connecting you to some monitors, and one of them is going to be tracking and recording your brain activity throughout the night. So we're able to see on the monitor, and again when we look through the recording, what's happening in your brain that's preventing you from falling asleep. Or sometimes there's other reasons. For example, people who have sleep apnea may not be getting enough oxygen to stay asleep. Some people have issues with frequent urination at night. There's lots of different things that can cause our inability to fall asleep. So all the information is good information and can help us piece together what's going on. Do you have any other questions? Okay, well then I have some questions for you. So the first one is, how frequently are you unable to fall asleep? Okay. Do you use any sleep aids? Okay. And do they help keep you asleep? Do they help decrease the time it takes to fall asleep, or? Okay. Are there nights where you're really unable to fall asleep at any point? Okay. If you do fall asleep and you awaken during the night, do you have a hard time falling back to sleep? Even with the sleep aids? Okay. What happens when you're trying to fall asleep? For example, some people have racing thoughts, or they just can't turn their minds off. They hyperfocus on certain things. Okay. Can you walk me through your typical sleep routine? For example, what you do like 2 hours before you go to bed, and then once you get into the bed. Okay. And one more question is, what is your stress level like on average? Okay. Got it. Okay. I'm just going to take a look here. Your medication list. All right. Well, let's go ahead and get started. right here, right in between my eyebrows, okay? Focus on my finger. Every time you see my light flash in your peripheral vision, I want you to say light, okay? Good. And now, without turning your head at all, I would like you to follow my light just using your eyes. Okay. Continue gazing straight ahead. Try to keep your eyes open. But if you need to blink, don't worry, it's okay. Okay. Sorry. Alright, good red reflex. Alright. Let's take a quick peek inside of your ears. Just looking for anything like fluid or scar tissue, any kind of perforation or inflammation inside of the ear. swap out speculum. I'm going to just take a look inside of your nostrils. Okay. And other one. Great. Okay. And let's check your mouth and your airway. So open for me. Beautiful. Alright, nice and clear. I don't see any swelling or redness. Okay. So now I'm going to check your throat and around your jaw on the outside. So let me know if anything feels uncomfortable or tender at all. Okay. Now I'm going to listen to your chest and hopefully not too cold. Okay. Can I get you to take a deep breath in for me, please? And out. Good. Again, deep breath in. And out. Again. And again. Okay. Not hearing anything concerning there, so that's good. Just gonna do a little tap on your chest, okay? Alright, so now we're going to get you connected to the monitor. First thing I want to do is take your temperature, so that way when I connect our temperature sensor, I can tell that it's correct. Sometimes it needs to be calibrated. And also, an increased temperature can interfere with our ability to fall asleep. Perfect. All right. Perfectly normal range. So now let's go ahead and get you connected. I'm gonna move my stethoscope out of the way here. Okay. So I'm going to start by sticking these little stickers onto your head, okay? They are electrodes that we will attach some wires to, some leads, to help keep track of your brainwaves throughout the night. So the first one goes right here, right in the middle. Just like that. Okay. I know that's a lot. Sorry. And I'm going to have to add to it as well. So this is our temperature sensor, which I'm going to tape right onto the side. Okay. And one last bit here is our pulse ox clip, which is going to be measuring your heart rate as well as your oxygen levels. So it just clips right onto your finger like so. Do you have a preference? Perfect. All right. I'll silence that. Just make sure we're reading. And okay. So we have our baseline here. So now we can start getting you ready to go to sleep. And so you said that you're having difficulty with the falling asleep part, with some racing thoughts and obtrusive thoughts, which is a very common thing. So first we're gonna do some physical exercises. The first one's gonna seem kind of funny. I want you to do this 6 times each time, or each side. You're gonna take the tip of your tongue and you're gonna push it into your cheek, like, and then switch to the other side. A little bit more slowly than that, okay? So, you ready? So, 1. Good. And other side. And 2, switch. And other side. And switch. 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 Again. Other side. And switch. And switch. Good. So that helps inactivate our vagus nerve, which can help us start to feel calm. So now I want you to take some slow, deep breaths. We're going to take 6 breaths in a moment. In a minute, in a moment. So we're going to inhale for a count of 5, and then exhale for a count of 5, okay? Okay, so breathe in. 1, 2, 3, 4, 5, and out. 2, 3, 4, 5. In. 2, 3, 4, 5. Out. 2, 3, 4, 5. In. 2, 3, 4, 5. Out. 2, 3, 4, 5. In. 2, 3, 4, 5. Out. 2, 3, 4, 5. In. 2, 3, 4, 5. Out. 2, 3, 4, 5. You should be feeling a bit more relaxed, at least physically. Yes? Okay. So now I want you to control your mind space. A lot of people like to try and completely clear their mind, which can lead to anxiety and frustration. Sleep anxiety is a very real thing, and it is often the cause for our inability to fall asleep. There are some solutions of trying to imagine yourself somewhere peaceful, like on a beach, imagining the ocean waves lapping up on the shore. You can hear those sounds and trying to imagine the smell. Maybe it's being in a forest, on a grassy field. There's lots of different peaceful scenarios that guided meditations like to use. But again, when we're trying to force our minds into a mental state, it can create that anxiety again. So instead, what I like to try and encourage my patients to do, and I do this myself, is one of 2 things. One, the first one, is to recall a memory, something that is positive or even kind of dull. Nothing too exciting because we don't want to get too physically stimulated. But it can be spending time with a friend or a loved one. It can be an experience you had, like hiking in the woods, but something that is a little bit more interactive, not just sitting there observing an environment. You don't need to recall the specifics of any kind of dialogue. It's totally fine to kind of just go with the gist of it, or even have it just sort of be a soft drone. But something that you can remember yourself interacting, okay? The other one is to create a scenario in your mind with somebody else or other people that you care about, where again you are interacting with them in a neutral or calm way. Positive is good. Too exciting works against us. It doesn't matter if you can't remember or focus on the details completely. Allow yourself to have some leeway to have your mind wander or to forget different aspects. And if you start having some intrusive thoughts during this process, again, that's okay. Just let them enter your mind and think about whatever your brain wants you to acknowledge for a moment or two, and then try to redirect yourself back. Okay? Doing this can give ourselves a way to distract from the sleep anxiety because we have a scenario to watch. We live in a day and age where we spend a lot of time with different stimuli coming at us, either from the TV, from our phones, computers. And so just trying to force ourselves into this box of either no thoughts or like a calm, peaceful ambience can work against us. There's a lot of pressure mentally on ourselves to stay in that moment or that mindset that can add to sleep anxiety. Okay? Okay. So then the other thing is I also find that when people try to fall asleep in absolute silence, that can also contribute to that pressure to fall asleep. Same kind of situation as forcing yourself into like a beach scene. So I'm going to stay in here for a little bit and I'm going to just review your chart and write some notes. And then I will excuse myself and put on some white noise so that way you're not falling asleep to complete silence. There may be a little lapse in there between my going from here into my booth, but it shouldn't be very long, okay? Okay. So I want you to close your eyes and come up with either a memory or a situation in your head and just watch it play out like you would watching TV.